So you've done a thorough assessment for ADHD. Now you have the diagnosis in your hand that confirms that you have the symptoms of attention deficit hyperactivity disorder. What do you do with this diagnosis? Stay tuned. We're going to discuss 6 ways in which you can start to treat and manage your symptoms. Thank you so much for joining me today. Today, we're going to discuss 6 ways in which you can start to treat and manage the symptoms of attention deficit hyperactivity disorder. Oftentimes people ask me the question after I've conducted an assessment, and if that assessment indicate that they are diagnosed with ADHD, that is, they have fit the diagnostic criteria for ADHD. So they ask the question, what next? One of the first things I recommend for individuals is to get proper information. There's a lot of misinformation out there about ADHD. So the first step is to get yourself educated. And education could come through reading books. It could come through listening to reliable lectures on ADHD. Learn what ADHD is. Learn how its impact on the brain. Learn different brain areas that are impacted. Learn about executive function. What is executive function? Which areas of your life does ADHD tend to seep in more often, especially around executive function? So learn about the disorder. Learn about how and where it shows up in your day-to-day life. So the first step is to educate yourself about it. And even though I use the word disorder, don't you see that word as something to pull yourself down. You see, ADHD is a different way to function. You have to learn your way of functioning. It doesn't mean the end of the world. It just means you know exactly where you are. And once you can say, this is where I'm at, I have been diagnosed with this thing called ADHD, what's my next step? So once you've gotten enough education, you understand the symptoms, you understand how those symptoms affect your life. You may think of a second option, which is also to get ADHD coaching. ADHD coaching is that you work with someone who also understand ADHD, and they're going to guide you through different principles you can use to address the symptoms of ADHD. You want to ensure you find someone who is educated, qualified, and who have the experience to guide you through this process. Some ways individuals can guide you through this. If you're working with someone who have in-depth knowledge of cognitive behavioral therapy, they could use some of those skills to guide you through the process. They can use some of those skills to help you to understand things more and how thoughts leads to feelings and behaviors. And this will also help with the emotional component of ADHD symptoms. So find a reliable coach, someone with experience, someone who can journey with you as you seek to become more functional with these symptoms. A good coach will help you to facilitate changes in the work environment, in social context, and for those who are in school, how to navigate school and access resources that can help you to manage these symptoms. So we've talked about psychoeducation as one method of treatment. We've talked about having an effective coach to help you through the process. Also, sometimes individuals might need psychopharmacology, that is medication. Oftentimes, the question I get, do you believe in medication for ADHD? And the thing about it, medication isn't a belief system. It's just something we can try to see if it will help to alleviate the system. It's medicine. It's a biological thing. It's not a belief system. So when you ask, do I believe in medication? The question that do I believe in medication? The reality is medication can be very effective. Try it and see what happens. For 80% of individuals who try medication, they get real positive results. If you fall in the 20% that it doesn't work for, then stop taking it. It's trial. You're trying the medication to see if it will help with your symptoms. And if you fall in the 20%, then that's okay. We can find other ways to help alleviate and reduce intensity of the symptoms you're experiencing. Also, we can think of behavioral ways to mitigate the symptoms of ADHD. And there are, when I say behavioral methods, I'm talking about getting active, getting engaged with exercise. Exercise is vital for the brain. You think about it. We've discussed in previous videos that ADHD is an executive function disorder, an executive function challenge. And executive function has to do with how my frontal lobe, my prefrontal cortex function. Exercise is going to allow increased blood flow to the prefrontal cortex. It's going to increase blood flow to that part of the brain. Thus, it will help to alleviate some of the symptoms. So you want to get in an active exercise program. And what I mean by active is where you're doing exercise at least 3 to 5 times a week. You're doing at least 20 minutes of cardio exercise. And that's going to tremendously help with alleviating some of the symptoms associated with ADHD. Also, another behavioral strategy is sleep hygiene. If you're not resting, then executive function is going to be impacted. So you have to develop effective sleep hygiene in which you're getting adequate sleep, you're getting to bed at an appropriate time, and you're doing things around bedtime that's going to facilitate more restful sleep. What does this mean? This might mean that before bed, we're going to limit, say, caffeine intake. We're going to limit the amount of screen you focus on. Viewing. So when I say bedtime routine, I'm thinking more, can you start to wind down about 30 to 45 minutes before bedtime? You sort of cut things out, slow things down, even start to do some meditation to relax yourself. And these strategies will help you to be more relaxed. And if you're more relaxed and you get adequate sleep, then when you wake up tomorrow or the day after, you will feel more restful. And this is going to help to reduce the impact of ADHD symptoms. So again, talk about these behavioral strategies. Start to practice them if you're diagnosed with ADHD. And if you have questions or comment, please ask your questions. The more questions you ask is the more videos I can produce to answer your questions. So today we've talked about some strategies you can use. Psychoeducation. We talk about having an ADHD coach to help you through the process. We talk about different aspects in terms of even medication, how medication can be useful. If it's not useful, then that's okay. We try another option. And we'll talk about different components of behavioral strategies around sleep hygiene, around exercise. And also one more thing to mention there is to eat healthy. Try and eat less sugary food. Yes, sugar does not cause ADHD, but sugar have a negative impact on the prefrontal cortex, and sugar will impact executive function. So again, we want to reduce our sugar intake. So let's review the 6 things. Psychoeducation, 1. Having a coach to help you along the process, 2. Potential of psychopharmacology. Behavioral treatments which include exercise, sleep, and proper diet. If you include these things in your day-to-day life with a diagnosis of ADHD, you will find that they will tremendously help to reduce the impact of the symptoms you're experiencing. Again, as I mentioned before, ask your question. I am here to help you to answer those questions and to guide you as you navigate life with ADHD diagnosis. I look forward to connecting with you again. Take care. Bye bye for now.